So my name is Anthony Bass. I am a father of 7. I am a former Minnesota Viking. I am a former Green Bay Packer. Also, I am currently the Senior Executive Director of the American Cancer Society, and also I am on and serve on the Nexus Family Healing Board of Directors. I'm excited to be here today. Also, I'm a doctoral student, starting my first year next month. Okay. If you all out there, see, we got our attention. Okay, now we're together now. So I joined the board because 5 years ago, I remember my wife is giving birth, and I heard code blue. And I'm like, what's? And I'm getting pushed out of the way, and people running around, and I don't know what's happening. I thought everything was okay. Later, I come to find out that my son was stuck, and they thought I was going to lose both my wife and my son. Thankfully, they're both alive. However, they did not come out of the incident without any scars. My son, who was born then, has partial brain damage, and my wife, through that experience, was given so much medication to numb the pain that she had a psychotic breakdown. For the first 14 days, she wasn't able to be home with her baby. She was in a mental health ward for 14 days. I'm a father of 7. I have 3 sons that are on the autism spectrum. I have a brother who was diagnosed in his mid-40s as bipolar. And so for me, mental health is going to be part of my life for the rest of my life. For me, Nexus and its success is vital for my family, for my community. And hopefully, by the time you leave here today, you'll have the same sentiment that Nexus is also vital for your community as well. Today, the need for mental health services are greater than ever. COVID-19 has skyrocketed already a existing critical issue to new heights. Now, if you're like me, you hear about these challenges everywhere. In our schools, healthcare systems, our communities, it's hard to know how we can help. Being here today and learning more about the work of Nexus Family Healing and how you can be a part of the efforts to stop or to change and to help is the first step that we're going through today. Nexus is a nonprofit organization celebrating 50 years of service this year. And that's something we can Nexus has been doing great work for decades, and yet many still are learning about this great organization. Well, Nexus is based here in Minnesota and supports children, adults, and families through crisis support and mental health services in schools and the community, specialized foster care and adoption services, and residential mental health services. Our services span Minnesota, North Dakota, Illinois, and Maryland, helping over 3,500 children, families, and adults each year. Sometimes people find their services on their own. Often they're referred to us by schools or social workers, hospitals, law enforcement agencies, and others find us in the community. Each child, family, adult is unique in their journey, and Nexus Family Healing is committed to being the individualized resource people can turn to even in the most challenging circumstances. At Nexus, we believe no one, and I'm a pastor, so I'll do this. Look at your neighbor and say, no one. No one. No one is ever beyond hope. That's why we never give up. We see problems. Where some see problems, we see potential. What some call impossible, we call mission. I'm honored this time to turn things over to Dr. Michelle Murray, the President and CEO of Nexus Family Healing, who can share more about the current mental health crisis and how our organization is responding. As I do so, I also want to recognize the corporate sponsors who are supporting this event tonight. Assured Partners and AmTrust, thank you. And Stonebridge Capital Advisors, thank you. We are grateful for all of your many years of support and partnership. Thank you.
Move this a little bit. Okay. I want to echo the thanks to both Assured Partners and Stonebridge. You both have supported us in so many different events along our entire journey of trying to get out there and meet more people and get involved. And so I'm so grateful that you're all here. I know some folks from Stonebridge were going to come more than what they could, but some things came up. But you've got quite a showing here from Assured Partners. Thank you again, Wayne, and your whole crew, and Lori, pass that on to Bob and them. We just really appreciate the support you all give. And I want to recognize we have several board members here. Anthony, lovely story. Thank you for sharing. It's so important when people speak to the heart of the day-to-day experiences they have. I mean, it just brings it home, and it helps us relate to the stories in our own lives and our family members and our communities that are doing this, struggling with some of the same things. And Paul, thank you. We've got other board members here. If you haven't met Pat, new board member 2 with us, John Hayden. Wonderful to have you here. We have some upcoming board members joining us too. So just thank you for everybody for being here. And I get the privilege of working with many of our staff here. This is a wonderful organization, great mission, and I just want you to know that Nexus is not the only nonprofit doing this important work. We're here to talk about mental health, and there's many of us out there that are trying to go down this journey of trying to heal our communities and our families and our youth. I'm going to use the word crisis. I think Anthony brought up a crisis. We really truly are in a crisis, and I don't use that term lightly, and it's really not even my term. It's what's really happening in the world. The Pediatrics Academy of the Pediatrics have declared an emergency for children with mental health. The Surgeon General has declared a crisis for youth mental health issues that are happening. And I mean, look at even just the news, right? We've had this event planned this entire year. And look what's just happened. Did you see the Star Tribune article that's going on? How many children are in emergency rooms needing mental health services, and we can't get them in. We can't get them places. There's nowhere to put them. Look at what's happened to Naomi Judd and the Judds right now that's going on. Mental health is across the spectrum. It doesn't matter your age, if you're famous, if you're just a regular person that people don't maybe know. I mean, it's just every age, every race, every culture, every community has real issues with this. I mean, look at what's happened in Buffalo. And I don't care if that person's filled with as much hate as they can. There's no way you can have that much hate in your life and not have a mental health issue. And we've got communities with mental health issues. We really, truly are in a crisis right now. And so I just want to thank you for just being here. We wanted this venue to be really small and intimate. This is a really important topic. So thank you for taking your time to just learn more about this topic, whether it's with us or just in our communities and other organizations that are trying to make a difference. So I just really, really appreciate that. I probably should kind of check in on making things, the statistics continue to be on the rise, like Anthony said. 1 in 5 people have some kind of emotional, mental health, developmental issue that they're struggling with. And 1 in 3 children report feeling hopeless and sad in the school setting. And that's going down to the first grade and on up. So we know that this is skyrocketing. And the real issue that's being faced right now in the mental health crisis that I'm sure that you're hearing, particularly in the news, is there aren't enough staff in the workforce to help meet the need that's out there. So we have two things that are crossing right now. We have a greater need than ever that has skyrocketed, and we're having a hard time getting people access to the services that they need. And that's really the biggest thing. So what can be done about it? You know, the primary things is just being at places like this and learning all you can about mental health and trying to lower the stigma and trying to become educated that this is not something that people do to themselves. It's not something that they just need to pull themselves up by their bootstraps. Mental health is as real as, you know, a broken bone or something like cancer. I mean, it is a part of our communities that people are struggling with. So becoming educated about it and what it means, and that there is help out there. We just have to pay for it. We have to find new solutions to get that. We have to get our legislators behind bills that help support services being accessible to children in schools and in communities and in centers. We've got to have insurance companies paying what needs to be heavy. They need the resources to make those kinds of payments that keep things going and sustainable. We really have to really focus on what our schools need too. Schools are hurting, and the teachers are struggling with all the behavioral and mental health issues that are going on with kids, and we need to be a part of that solution. And I'd say the biggest thing is recognize that when people struggle with mental health, children in our communities, they're not thriving. And we know when people are not thriving, communities start to fall short. When people can't go to school and go to work and be contributing to society, our entire community suffers from that. You know, Nexus Family Healing is in a good position to help with things like this. And like many others that are out there fighting this fight, you know, we like Anthony said, this is our 50th year anniversary, and we have been deep-seated for many years in trying to address this mental health crisis in whatever ways that we can. One of our biggest pushes right now is really making sure that we stay focused on the family. And another part of our value system is that we make sure we serve people who have lost hope, where there hasn't been other services or other resources, or they've tried other things that hasn't worked, or they're just not able to get the kind of help that they need for their particular situation. So we really want to tailor to people who are not getting services and their needs met in other ways, in addition to the family, and trying to be as innovative as we can with our services. And just in this last year, we were really thrilled to kind of venture into more of our community-based services. And we're actually the operating partner for the Southeast Regional Crisis Center in Rochester. And that was actually the brainchild of some leadership at Olmsted County and working with 9 other counties, where they said, hey, look at this emergency room backlog that we've got going on. We've got to solve this problem. We've got to stop trying to treat mental health in the ER. And so the leaders got creative and innovative and said, let's develop this walk-in crisis clinic, which is what the CERT program is, the Southeast Regional Crisis Center there in Rochester. And it lets people come in any time of the day and night and get their needs met. And it's gotten great support from Mayo and Blue Cross Blue Shield and UCare and Medica and other funders that are really serious about trying to solve this problem. And it's been a great thing to be a partner in, because we're really seeing that when people have services right in their community and they can get the help that they need right there with no judgment and not going through the hospital setting where they don't need help, it's just made a tremendous difference. You know, in last year, we also focused a lot more on getting into our schools in several of our states, working more in the schools to try to assess and try to divert kids to the right direction with their families so that they don't get worse, and so that we can be more preventative rather than reactive after it gets too far. And that's been a really important movement for us. We also last year entered into a contract with Hennepin County to provide family response and stabilization programs. And what that is essentially going into families' homes when they have an immediate crisis and being able to just immediately help them so that it doesn't spiral out of control. It doesn't result in removing the child from the home. And these are the kind of innovative things that we really want to be a part of as our communities are changing And as the need is getting higher, we want to keep kids and families together in their homes, in their communities. And those are the kinds of partnerships with our community members that are so important right now. We're also really looking forward to this year continuing to grow our school-based programs in several of our states. And there are bills out there right now that the legislation in the state is really taking a look at. And just get in touch with what the bills are and what you vote on and who you support. And are they out there really concentrating on what our communities need for mental health? And that's really the start of how we divert our resources and where those go. Our schools need our help so desperately. You all know that. You see the news. You see children, grandchildren, nieces, nephews, community members that are really struggling, whether they're teaching or the children. We also are going to be expanding our early childhood programs that are taking place right now in the Mandela Heights area. Again, trying to divert children to get the services where they need them the most so that they don't get removed from their home. And this fall, we've also partnered with Dakota County to open a shelter program for teens and youth who are in crisis, to try to just get, again, that immediate need when the need is at the highest peak. So I just really appreciate you all kind of learning more about us. Please ask us questions. I know there's a lot more that we're not sharing here with you about every little thing that we do, but just know that our mission is to heal kids and families and adults. We want our communities to be stronger. We offer mental health services in a variety of ways, and the opportunity that you have is, again, just learn more about us. Learn more about the mental health needs. If you want a way to make a difference, there's lots of ways that you can offer your support of us. Whether it's through partnerships, through communities, through hospitals. We've got some newer partnerships through Fairview where we're taking kids out of their inpatient psychiatric so that they don't have to hold on to them, so that they have an open bed. Those are the kinds of partnerships that we're trying to develop with our community to help solve the crisis that's taking place. There's ways to volunteer. There's ways to donate. If there's a certain cause that you have for our organization, let us know. We can get you in touch with what are the things that you are really passionate about and really care about. Because this year, what we're really focused on right now is the financial shortage of the community mental health programs. So things like the outpatient, the school-based programs, the in-home services. There's just not enough resources to cover the cost of those services. And as we try to grow and expand those, that's really where our communities need our help the most. And that's really where we need people's support. So thank you again for being here. Please take the time to eat, get a drink, mingle, and be with us, and we really appreciate it. And now I'm going to turn the time over to Eric Mercer, who is a board member of our Nexus Foundation. He has also been a great supporter of us and has been a parent of a child who has received services. And so I will let him tell what he wants about his story, and thank you.
Thank you, and good evening, everybody. My name is Eric Mercer, and I've got 3 extraordinary adult kids and a beautiful wife, Jeremy, who's here with me tonight as well. And thought that I'd share a little bit about our connection to Nexus and why we decided to get involved. I'm the managing partner of PricewaterhouseCoopers here in Minneapolis, and also as Michelle said, a board member here. So we became involved about 8 years ago. We were on a journey, as Anthony has said, you don't always know this is going to be part of your journey. I think looking back 10 years, we wouldn't have thought that it was. It came. And it was our youngest son was dealing with a lot of mental health issues. And to Michelle's point about access and trying to get in, I can't even imagine what it would be like right now, because I think it was probably easier back then, but it was still tough. And trying to navigate the systems and get him to a place where we thought he'd get the help that he needed was very difficult. I remember exactly like what he needed, but there were no beds. And so we needed to kind of work the system a little bit. And thankfully, we had a doctor that we worked with that helped us navigate all that. And we got him there. And when he got there, he really developed the core coping mechanisms, the capabilities, the resources that he needed to be able to deal with the mental health issues himself. You know, for my wife and I, just getting him there was such a relief because we felt, okay, at least he's safe, right? And that was the first thing. But then beyond that, he grew, and then it became a whole family thing, and we became a part of it too, and we really were on this journey together. So it's been a big part of our family's journey, an amazing, positive, bright part of our family's journey. But it wasn't always easy to get there. We didn't know where to turn, and we didn't even realize at the time probably the many resources that we now know that Nexus offers. I'm committed, along with my family, to letting people know that help is available. You've heard about the many ways Nexus is responding to the current mental health crisis and is offering new and expanded services. And we brought you all here tonight to ask for your help in spreading the word to others in the community. This is a topic that thankfully is becoming, I think, a little bit easier to talk about. Perhaps in the past it wasn't, but it's great. It needs to be talked about. We need to have forums and let people know that help is out there. But we also need to make sure that the services can be sustained in the midst of current economic challenges, and that people of all incomes and backgrounds are able to access this critical care. So, for example, many people who seek out our support don't have insurance or have high deductible plans, and make it nearly impossible for them to afford weekly therapy sessions, much less a residential program. We know that different cultures view mental health differently, and a Black or Latinx family may need different types of support or might connect to help in different ways than other cultures. Which is why I was proud to engage my firm, PricewaterhouseCoopers, in providing a grant to support a sliding fee scale and outreach efforts at Nexus that will reduce the barriers and increase access to community mental health services provided often low income families. As Anthony and Michelle both highlighted, the need is enormous and continues to grow. As community leaders, we're all well positioned to spread the word about the resources available. And I share our family stories so that we remember that mental health challenges can affect any person or family. It's very likely that someone you know or work with or see every day might be in need of help. It's interesting though, because as amazing as Nexus was in our life, in our journey, as pivotal a point as that was in Dan's life, when he came home to us, we could have all just gone on our merry way, and it was interesting because it was the Thanksgiving after he left the residential program. We were all together, and believe me, we all felt a tremendous amount of thanks needed to be given that year, that we were all back together. And I had asked the kids to think about, from a financial perspective, who they might want to, share some of our good fortune in thanks. And Daniel, our youngest, I think was the only one who took that seriously. And he gave us some thought. And he came to us and we talked about it at the dinner table that night. And he said, I think that we should be giving back to Gerard because they made such a difference for me and for our family. And I thought, well, yeah, that's kind of an obvious thing. But it hadn't even struck me before that there might be a nonprofit foundation affiliated with the center. So we looked into it and we made the donation per his request. And I think that it piqued somebody's interest over there, perhaps Michelle. Somebody, and it was probably 4 years ago at an event exactly like this, that I was invited with Jeremy, and we came and we just came to learn about Nexus. And here we are 4 years later. I'm on the board. She's on the gala committee. We are very thankful to be able to support in the way that we do. But again, it was that moment of Dan making the connection for us, right? Him saying, no, I think that we need to give back now. And that was important for us. But that's the reason that we're here. We're here because of Dan for multiple reasons. So I want to thank you all for coming tonight. My wife and I both look forward to talking to any of you that would like to hear more about our story or hear about how we got involved in Nexus. But mostly just thank you for being here, and please enjoy yourself.
Well, thank you so much, Eric. We really appreciate you sharing your story, how you've taken the opportunity to give back to Nexus. So as you know, there's a lot to learn about Nexus and mental health in general. We try to keep this brief, and this is coming toward the finish line. And so we have a couple of things to ask. Even though we've only scratched the surface, this is the 3 takeaways we want from you today. Learn more. So reach out with questions. In addition to Dr. Murray, there's several staff. Any staff in the house tonight, raise your hand. Yeah. So if you have any questions, please ask. Subscribe to our newsletter, social media sites, take a tour, find out more about Nexus, the work that's being done. Share the story. You'll hear this over and over. I didn't know that Nexus existed. When I found out, it was like serendipitous. The place I always needed to know that was here. As I said in my story earlier, I felt hopeless. Looking forward in my future, I didn't know who could I turn to. And I'm comforted to know that Nexus exists if I need help. And so for you, if you're inspired by anything today, talk to legislators. Let people know that mental health is an issue and you're concerned about it. As was said earlier, 1 in 5 people are struggling with some type of mental health issue or know somebody who's struggling. We need to get the word out that there's hope. Join with us. As a nonprofit, we rely on donations. Minnesota is one of the most giving states I've ever been to. And you all are great at helping your community. Nexus is one of those organizations that needs your support. I've looked and been a part of a lot of nonprofits, and this one is here to stay. It's a good thing, but then again, it's kind of sad, right? Because we know mental health is not going anywhere anytime soon. And so, if you give, it'll help. It'll help the cause. It'll help provide high-quality programs, training for staff. It'll help expand work throughout communities so that we're meeting the needs of children, adults, and family. And so I'd be remiss if I didn't invite you all to join our gala as guests on September the 30th, which is Nexus Night fundraising gala. It's going to be at the Metropolitan Ballroom. And so let me say that one more time. If you can join us on September the 30th at our 4th annual, I got that right this time, Night for Nexus fundraising gala, or gala, as my daughter forces me to say. It's at the Metropolitan Ballroom. So you won't miss this inspiring evening. Details are near the entrance as you go out. And also, once again, I'd like to thank our corporate partners and sponsors and trust, Assured Partners, and Stonebridge Capital Advisors for their generous support that made this event possible. Could we all please give them a hand for their So we've heard this multiple times. We hope you stick around. I think there's a lot of food available for you. I can't take it home by myself, even though I have 7 kids, so make sure you eat up. This great staff is here, happy to answer any questions you may have about the organization. Someone from the team will reach out to you and in the coming days. Hopefully, you'll be able to answer some questions and provide some feedback. Also, there's this takeaway for you. And so as you leave, make sure you get this. You cannot leave without this. It's important for you, just so you know. If you get that information on there, it'll be helpful for us to know that you heard. You know, as a communicator and speaker regularly, I know that people only retain 3% of what is communicated. And so our hope is that we can reinforce some of that information with this information as you leave. Lastly, thank you. Thank you for coming. We can't say thank you enough. You've taken your time and come here and used it to spend with us. You could have been with your families, friends, loved ones, but you came out here. Thank you for making the effort. Have a great day.